Hello, my name is Jody Duty. I'm a family nurse practitioner student at Eastern Kentucky University. My integrated review is regarding childhood obesity. My PICO question reads, in obese school-aged children, how does provider or school-supported obesity prevention education for families as a unit compared to the education of a child or parent only affect the weight or BMI of a child in a 6-month period? According to the CDC, obesity among children and adolescents have been steadily increasing over the last 30 years. Nearly 18% of children and 21% of adolescents are considered obese. The CDC discovered that nearly one-third of children and adolescents in the United States are considered either overweight or obese. Children suffering from obesity statistically have more health issues as an adult. Proper nutrition and quality physical activity are keys to lowering BMI. For the integrated review, 3 random control trials were studied. The first, VOS 2012, studied 81 families of obese children. They were separated into 2 groups, the control group and the intervention group. The control group was given basic knowledge of physical activity and nutrition. At follow-up, there was little to no change in the BMI of the subjects. The intervention group was given access to a dietitian, a physiotherapist, a psychologist, and social work. At follow-up for them, BMI was significantly lowered. FRIEND 2013 followed 62 families of obese children, which was also split into a control group and an intervention group. The control group was given instructions on authoritative parenting, which is simply strict feeding behaviors. At follow-up, there was only slight improvement on the child's BMI. The intervention group was split into 3 further groups, and all participated in the Project Fun. There was the child-only group, the parent-only group, and the family group. The parent and child-only groups had slight to minimal BMI improvement at follow-up, although the family group for the Project Fun had great improvement in the BMI. Finally, Wright 2013 followed 251 families of obese children. They were also split into 2 separate groups. The control group was given simple exercise program guidance. There was little to no improvement in BMI at follow-up. And the intervention group was placed in a program called Kids and Fitness. This program was for the entire family, and at the end of the 3 months and the 12-month follow-up, there was a significant decrease in the BMI of the child. There were strengths, limitations, risks, literature gaps, and similarities with each of these studies. One of the major strengths was that Wright has an adequate number of subjects, giving us a large amount of data. A limitation was that with VOS and FRIEND, they had a limited number of subjects, giving us a smaller data set. Risks were, with the Wright study, most of the Kids and Fitness program was completed during school hours, so these children had a risk of falling behind with schoolwork and school activities compared to their peers. As far as literature gaps, the long-term data is only a mere 12 months. For children ages 8 to 17, a lot can change after a 12-month period. There should be a longer follow-up period. In order to develop proper evidence-based practice, one needs to identify the need for change. After that, they need to locate the best evidence, critically analyze that evidence, then they need to develop a practice change. Once that occurs, the family nurse practitioner must implement and evaluate the change in the practice at the present. Once that is obtained, maintain and monitor the change. Family nurse practitioners must intervene. A promising intervention to aid the control, prevention, and elimination of obesity among school-aged children would be to integrate the family involvement. Without the inclusion of the family as a whole unit, the child is essentially left alone to deal with this very adult issue. As a family nurse practitioner, one must have the knowledge and the courage to confront the parents and the means and bolster their understanding of the long-lasting implications of obesity can have on their child's life. To do this, the family nurse practitioner must evaluate all children within their practice for risk factors or findings of obesity. Once that is established, a meeting with the family unit should be arranged. This meeting must consist of 2 different topics, nutrition and physical activity, by either online guidance or pamphlets. Once those areas are explained and understood by the family unit, follow-up sessions must be established weekly, then monthly for the first 6 months. When the changes in BMI have occurred, the family nurse practitioner will follow up with the child and the family as a unit every 6 months to reinforce education and encourage successes. Perhaps even a success board could be placed for all patients and families to see in order to celebrate the patient's accomplishments. Thank you.